Hello, this is Dr. Stanley Lang, and welcome to this video. The topic of the video, which is how hope can heal, is designed to focus on a spiritual principle, not the idea of, I hope something good happens today. So I'm not talking about the word hope as it's used for wishful thinking, but hope as it's used in the spiritual sense. And when we use hope, the word hope in this sense, it means that I expect good to come of whatever's happening. And I expect this in the context of my relationship with God. Now, hoping for something in the I hope something will happen isn't bad, but this other sense of what the word hope means is much more powerful. It's much more transforming because I'm expecting God to do something. And I was looking over the list of patients that I saw today and thinking of who in this list is making a real difference in the lives of other people and who is just basically so self-absorbed in their symptoms that they're not really touching anybody else's life to a significant degree. Or they just sort of checked out of life. They're kind of retired and not doing anything. They're kind of happy with cruising along. So I was just looking at the list and I'm thinking of who is doing the most right now to touch the lives of other people, at least as much as I knew of their lives. And on this whole list, I knew all of the people pretty well. And this one person sort of stuck out because she is making such a huge difference in the lives of people around her. And her story is one of having gone through 2 different episodes of homelessness recently. And she talked about how she had she'd moved up from homelessness to a tiny, very tiny apartment to now she had a 1-bedroom apartment and she thought she was living in a mansion. And this person was also dealing with diabetes. And she was dealing with it in a way that she didn't know that she had the option of using lifestyle to reverse it. And when I told her that she could actually do that, she was so excited. Now, this is a person who is not young, but she was so excited that she could actually get off of her insulin, that she could get off of her medication and get her body's chemistry right simply by good lifestyle choices. And she had this expectation that it was going to happen. Now, this gave her even more energy to reach out and touch the lives of other people. It sort of spilled out of her life that she was living this hopeful life. 2 patients later, I'm seeing a patient who has heard the same explanation of what she could do to reverse her diabetes, and she's had excuse after excuse for many, many years and is slowly declining into all of the complications of diabetes, every one of them. And she's going to end up in greater and greater misery, unable to help anybody, unable to reach out and touch the lives of anybody because she's so self-absorbed in her own symptoms. This first patient is completely focused on other people most of the time. And that's my experience of her. And I was actually astounded as I heard some of her story. So I want to encourage you that bringing hope to the situation where you're actually expecting God to bring good into the situation, but you're also doing your part. You're doing the things it requires on your part to get better from whatever your chronic condition is. And many chronic conditions, there are lifestyle strategies that you can follow that will help you to get better. Maybe not completely better, but a lot better than where you're at right now. And that's what hope can bring. When you're sunk in despair, you're not making any movement. And a lot of reasons to have had self-pity wasn't focused on self-pity at all. She was focused on other people that she could help and was still helping, even though her circumstances were so limited in terms of her resources. She was using what she could to touch the lives of other people. And of all the people that I saw this day, she was the most joyful. And I think that there's a connection between that. So I encourage you to grab onto the idea of hope is an option. You can choose to hope in God's love for you. You can choose to hope in God making things better for your life because he wants to, but we have to do our part. We have to do the things we can do and choose not to do the things that undermine whatever that part is. And when it comes to getting better from chronic disease, there's a lot of good things we can do, and there's a whole lot of ways to undermine it. And we have to be committed to not doing the things that shoot ourselves in the foot. That's our tendency, but it doesn't have to be that way. It's just a tendency. So I hope you found this reflection helpful. I wish you all God bless and have a great day.